I'm Dr. Whitney Jones. Colon cancer should be a disease of the past. What really changed my life is having to walk out to that 55 or 56-year-old guy or woman who's getting ready to retire, who's come in with symptoms or some type of problem, and I've got to tell them that that's not retirement anymore. You're in the battle. You're going to be fighting colon cancer. Imagine taking someone who's 50 years old, who has no symptoms whatsoever, who's going to take a day out of their life, drink some medicine that cleans out their colon, and at the end of the whole thing, you go to a physician or a surgeon or a hospital and have a long tube inserted up your bottom. It's a hard sell. You know, the good news that I would try to tell most people who are thinking about this and considering is that going in without symptoms for screening 99 times out of 100 is going to be good news. Usually what happens is you'll have to take a day and set it aside because most people get sedation and spend the day at the hospital. But the day before, you eat a clear liquid breakfast and sort of be on liquids most of the day. Towards the end of the day, you'll drink some medicine or take some pills that will essentially cause you to get rid of all the feces in your body so that you can have a clean examination of the colon. The next day you get up bright and early, feeling 5 pounds less heavy, almost like a spa experience. I thought we could add some vanilla candles to really make it happen. But that being said, you come in, they start an IV in your hand, the doctor talks to you, the nurse evaluates you, they give you a light sedative. Again, some people lighter than others, it just depends on your comfort level. But we don't want anyone to be uncomfortable or to be in pain during the test, so we vary our sedation to the point where you're where you want to be. If you don't want to know anything, we can do that. If you want to watch, we can do that. We can go anywhere in between. Test itself takes anywhere from 15 to 30 minutes. If we find polyps while we're in there, we remove them. If we find abnormal growths, we can either take them out or biopsy them. Yeah, we're really snipped out. We use a little lasso, a little small snare lasso, and it goes over the polyp, and you just snip it off at the base, like the base of a mushroom, if you will. Anything else that's abnormal, we note and document. And again, the whole thing is 15 to 30 minutes. Takes you about a half an hour to an hour to wake up, take the IV out, you head home. You have a lot of gas you got to pass after the examination, but the good news is most of the time you end up at your favorite lunch place. And that's the good news. Like I said, that's 99 times out of 100 when you come in for a colon cancer screening. That's going to be the answer you get. And even for that 1 in 100, you got it caught while you didn't have symptoms, and so it's going to be a good outcome. Not being screened for colon cancer at the appropriate time is like Russian roulette.